So I've just spent the past 45 minutes trying to do a video, and I thought, sod it, I'll do a live, and then if I make any mistakes, just ignore them. So this is a message for the Tory party and Labour, because both parties over the last 2 years have ramped up their vilification of disabled and chronically sick people. And I, for one, have had enough of it. So that's what this video is about. So this message, bearing in mind people change positions all the time, and last week I would have been aiming this at Steve Barclay, this week it's at Victoria Atkins. This is mainly for the Ministers of Health and the Chancellor, whoever they may be, shadow and in power. So I would say that Labour and the Tory party are both as bad as each other when it comes to benefits. Because Labour are all about workers. Workers are the best thing since sliced bread. Everybody should be working. You shouldn't get anything if you're not working. Tory party are just the nasty party. I don't like disabled people in general, or the other type thing. We all like austerity, etc., etc. So my message to the Conservatives specifically is, you created the current issue with the number of people that have chronic illness and are unable to work. What do I mean by that? I mean that since the start of the pandemic, I have been asking for, as an ME campaigner, for a comms plan, one that explains that illnesses like ME/CFS are triggered by viruses as well as other triggers, and that there was a risk that hundreds of thousands of people would likely go on to get ME/CFS because of COVID-19 or an illness that was very like ME/CFS. But to this day, there is no comms plan. It was mentioned in the COVID inquiry a couple of weeks ago, but they were talking about 2020 as if, oh, we've got a comms plan now. We haven't got a comms plan. The government still has yet to acknowledge that COVID-19 can trigger a range of chronic illnesses. It's just, oh yeah, long COVID, it's a new thing. Oh, look, we'll chuck money at it. We've got to find out exactly what's wrong with long COVID, blah, 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 which is fine. But they're not acknowledging that it was known in 2020. And that where is the, oh yeah, all they're saying is we want you to treat it like a cold and you don't have to wear a mask. Freedom. They have not mentioned the risk of chronic illness. It's all about death, death, death. They've also never publicly mentioned that COVID-19 is an airborne virus. If you have a look at government official websites, it's hidden in the small print. But I've never, bearing in mind I watch news a lot, I watch a lot of the government briefings a lot because I'm a politics nerd. Can't help it. I've never personally heard a minister admit that it's airborne. But Westminster obviously know it's airborne because it's mentioned in small print on their website, but also Westminster had a ventilation system fitted about 2 years ago. So how come treating it like an airborne virus is okay in Westminster, but not in schools, hospitals, public transport and workplaces? I've written down some notes because I keep forgetting what I need to say. So my point would be, the public are unable to make informed decisions about their own health and the risks to them in terms of, oh, I'm going into a healthcare setting. I know that COVID cases are up a bit at the moment. I'll take extra precautions. But instead, they think it's a cold. And if I stand 6 feet away from someone, I won't catch anything. What they don't realise is that it lingers in the air for, I think it's 9 or 12, between 9 and 12 hours. And you could walk into an empty room and have a mouthful of COVID. There you go, you're infected. Public don't know that. And there also are now no available to the public to buy or free. Free is like nothing is free. You can't prove that you've got a COVID infection because only around 10% of LFTs are accurately, I say diagnosing, what's the word? Proving that you've got COVID-19. I myself have had COVID 4 times. Only one time it's shown up positive. Because of this lack of a COVID test, it's very difficult to get a diagnosis of anything, because it's like, oh, well, you didn't have COVID. Oh, I don't know what causes that. Or let's just wait and see if you get better or whatever. That diagnostic test would make other wider things easier to prove. It's also very difficult to get benefits if you've got no way of proving how your illness started. There's now estimated that 1.25 million people in the UK alone now have ME/CFS and post-COVID ME/CFS. And only 25% of those people are physically able to work. Now, we knew that before COVID. There's been extensive research, only around 25% are physically able to work. And many of those people can only work part-time and flexibly. So we would expect that to be replicated amongst the post-COVID ME/CFS people. So we knew that. That's why throughout the height of the pandemic, we're still in the pandemic, I'm not saying that, but at the height of the pandemic, 2020, 2021, I was writing to governments, my local government, my local NHS board, the NHS, anyone I could possibly communicate with, saying, please do a comms plan, because people need to know. Yes, I agree, Deborah. People need to know that the risk is still there. Something that really annoys me is I've been an advocate for 9 years now, 9.5 years. And so many people just think ME is tiredness. So you've got that. And then you've got them saying, oh, well, COVID's only a cold. The risk of chronic illness is really low. It's not. I think it was 30% go on to get long COVID, and half of those at the 1 year point meet ME/CFS diagnostic criteria. So not only are we now combating the ME's nothing to worry about. Yeah, well, some people do, some in rare instances. It's heartbreaking every time somebody does die from ME, but it is rare considering we now have 1.25 million people with the disease. So not only are they lied to about what ME is, they're lied to about what COVID is, and about what their risk is. So where is the accurate information to make people as informed as they need to be about their chronic illness? About the risks of COVID. In terms of disability benefit, being disabled or chronically sick is often doubted due to a lack of diagnosis. You'll often hear national charities saying the majority of people that meet the diagnostic criteria for ME/CFS do not have a confirmed diagnosis. So even if we didn't have issues with SNOMED, which is the medical record system in the UK, you wouldn't. So, right, let me explain. People that don't know. Electronic medical records. In theory, when a GP types in, if they knew what ME was, in most cases, they would put down a code, and then they press enter, and it'd go off to some central database. And all you would have to do somewhere on this central database is say, how many people have got this code recorded against their medical record? Press a button. Oh, there's 100,000 people with an accurate record of ME/CFS as a diagnosis. Unfortunately, there are issues with coding. There's issues with GPs not knowing what ME/CFS is, not knowing how to diagnose it, no biomarker. You've got all that, and the false narrative about what ME/CFS is and is not. It's a psych illness. It's not a psych illness. It's not a psychological illness. So you've got all that. But all of that doesn't make the people that have got ME/CFS any less sick. All of the wider claptrap, the wider stigmatising nonsense, the gaslighting does not make the patient community any less disabled or chronically sick. And that's why I get angry, because it seems like we have so many barriers to so much stuff within our community. And then you have the government, who are partly at fault for how many people now have ME/CFS in this country, saying, there's nothing wrong with you, get back to work. People that should be able to work should be in employment. Nobody chooses to. What happens with a lot of people with ME? They lose their job. Some either lose their house or have to, go to somewhere smaller that's more affordable, lose friendships, lose various relationships, end up in divorce, relationships with children get tense. All of this. Who would choose that? Even there's the argument, oh, it's free money. It's stressful living on the breadline. Very stressful living on the breadline. So for example, case in point, I've been on working tax credit for a few years because HMRC said to me, oh, you're not applying for working tax credit, you're entitled to it. We see that you only work 20 hours a week. So I applied for it, got it, great. Didn't have to prove that I was disabled. It just topped my money up a little bit. Perfect. I was still working. So I got that money because I was working. But now they've moved it over to universal credit. I had an appointment on Monday and it was, you have to prove that you're disabled. It's up to DWP to work out if you're in gainful employment. I run 2 social enterprises. HMRC always used to say to me, it doesn't matter how much your income is, doesn't matter what your disability is, because you're working, you're entitled. There you go. Whether you agree with that, I'm just trying to show the difference between the two. Whereas with DWP, they've said, we need your GP to prove that you are disabled. We need your GP to give us the woman at the DWP was lovely. I'm not going to criticize her, but I've had so many bad dealings with DWP. I'm kind of waiting for the negativity from DWP, so I'm braced for it. So I've had ME for 17 years, but I've now got to get a fit note every 6 months from my GP to prove that my circumstances haven't changed, that I'm still disabled, that I'm still chronically sick. Now, I'm just one patient. If they're going to do that to the whole 25% that are physically able to work, are probably on working tax credit to top up, get the extra, or the other benefits that you can top up with, that's a lot of pressure on GPs, isn't it? If you think about it, that's every 6 months a fit note. That's a lot of extra work that they didn't have to do before. It moved over from HMRC to DWP. Anyway, my point is, you created this problem, government and shadow. I keep reading, need to get Tories out when Labour get in, it'd be better. Why would it be better? Labour are very focused on working people. Work, work, work. If you actually read the rhetoric coming out of Rachel Reeves and Wes Streeting, it's we are here for working people. And remember, I know it's history and it was a long time ago, but the PACE trial was under Labour. It was Labour's DWP that funded the PACE trial. So in my mind, they're both as bad as each other when it comes to disabled people and benefits. So I personally embraced for a long-term fight, whichever party wins the next election. Nothing's going to change overnight. But at the moment, it's very obvious that political parties are briefing right-wing media because all the media are doing the same messaging over and over and over. People on benefits are bad people. They're lazy. They've heard it all before. And I've written so many blogs. I've written to government. I've written, people that have followed me for ages will know that I contributed to the government's, what was it called? Jobs and Support Employment Inquiry, something like that. And that was in January 2023. And I said, this is the problem. More and more people are now getting MECFS as a result. As I said at the start of this, we don't yet scientifically know the minute differences between MECFS and post-COVID MECFS. But because we all present with the same diagnostic criteria, you're going to get an MECFS diagnosis. So, so more and more people are going to end up with MECFS, of which only 25% are physically able to work. So they've been warned over and over again. But instead of dealing with that, instead of saying it's airborne, we're not asking you to lock down or whatever, but we need to protect the economy. So can you please at least make sure that your workplaces are ventilated? But instead it's a cold. It's very mild. You'll sail through it. You'll be fine. They're not even telling people to rest. I've given up telling people to do that now. If you get assessed as having, what's LCWRA? Can you type it? I don't know what that means. No longer have to provide fit notes. It was a very long meeting with DWP on Monday. I started to get very confused, and she did go into lots of stuff. And she said, "I'm so sorry. You can look it all up on the website." I haven't had a chance to do that yet. yes, there are proactive measures that whoever's in government could be taking now. You don't have to scare people. You just say, we've known this for a while, limited capacity for work. Yeah, I think that's what she's going to put me forward for. But she said, if the DWP decides that I am in gainful employment, then I am going to have to provide sick notes. So I won't know until January, but thank you for that, Deborah. Yeah, there are active measures that governments could be taking now, and they're not. But they're very happy to complain about the amount of people that are so poorly they can't work. I'm not naive. I know that there are a 0.00001% of disability claimants who aren't disabled. That has been a problem historically, but you have to accept now that millions of people are now really poorly and unable to work, in part because they were not told that it's airborne, were not told rest during the acute phase to reduce your chances of becoming chronically sick. It just makes me so angry. Reap what you sow. I've said that so many times, but they are doing nothing. Absolutely nothing. So, for example, this morning I went to my GP surgery for a checkup, and they've still got the COVID messaging, electronic board, hand face space. I had my N95 on, and somebody behind me had a blue surgical mask on. I thought, I'm not going to say anything. But there was just two of us, 30 people, and every member of staff that came out didn't have a mask on. My GP didn't have a mask on. So my sympathy is limited when I hear about all these GP surgeries that have had to shut up shop for the day because they've run out of staff, or their staff are sick. And it's like, if you don't even know the basics of how to act in a public health, I call it crisis, but I don't mean, I'm not like, what's the word, catastrophizing. It's just I can't think of the other word. Still in the middle of a pandemic. And what my worry is that estimate was in June, 1.25 million. I would be very surprised if we're not up to 1.75 minimum now, because now you've got all the people that got chronically sick during the waves. So yeah, I reckon we're up to about 1.75 minimum now. It's getting bigger, and they're still doing nothing. Absolutely nothing. Anyway, so please know, anyone that's chronically sick or disabled, I get just as angry as you do when I see media report after, especially Jeremy Vine's particularly divisive. You might as well say, do you believe that people can be chronically sick? Some of the questions that he asks, it's like, I don't give a monkeys if they believe that I'm chronically sick or not. They're not medically trained. They have no impact on my life whatsoever. But I wouldn't wish ME/CFS on my worst enemy. And at the moment, a lot of my worst enemies are getting ME/CFS. Honestly, I shouldn't laugh. Yeah, more and more people that I know, acquaintances, not friends. And I'm like, well, you didn't listen to me. I've been going on about this now since March 2020. My friends are informed. My acquaintances are informed. Whether they choose to listen or not is another matter. Anyway, thank you very much for listening. But yeah, remember, getting angry uses energy. So let's just try and ignore them. But I will be emailing yet again the culprits. So at the moment, that's Victoria Atkins, Jeremy Hunt, Rachel Reeves, and Wes Streeting. Now, I think they all think it's going to help them win the election, but nobody with a disability is going to vote for them or their carers. I personally wouldn't, because that's just, if they're going to do that now, what are they going to be like when they're in power? Anyway, I'm going now. Have a lovely Friday. Have a good weekend. Catch you later.